My name is Jackie. I'm one of the nurses at the Louisiana Center for Bleeding and Clotting Disorders, okay? And that's where Jordan's receiving his care for his hemophilia, his factor VIII deficiency. So this handout that I gave you, this is a PowerPoint that I use for, mostly for teachers and daycares, so it's kind of, it's not, it's pretty basic, which I think that's kind of what you wanted, right?
Yes.
So this is the in-service that I gave on Wednesday at the daycare center for Jordan, and it was very well received. The ladies were very engaged. They asked a lot of questions. I asked questions at the end, and everybody was able to answer. They did really well, huh, Alexis? They were able to answer the questions correctly. So please, if I say something and you have a question, just stop me then, so we can talk about it while we're going over that. Or if you want, you can wait till the end, but you will be able to ask whatever you need to do. No embarrassing, Alexis. I heard there's no filter, but it's okay. My family doesn't either. My parents are 90, so believe me, there is no filter, okay? So we're gonna get started. Okay, so here on the first page it says we service the whole state of Louisiana. We service Texas, patients in Texas, Mississippi, and Alabama. We have patients that move away and they come back. Like they don't leave us, or they go away and they go to another center, and then they end up traveling back to Louisiana for their visits, because we give comprehensive care. They've been with us since they were little. They know, we know their family. We've seen them since they were a baby, and they don't want to go somewhere else, so they come back, which is great. It's fine with us. We are one of 2 hemophilia treatment centers in the state of Louisiana. We're the only one that we're federally funded, and we're the only one that is from birth lifespan, birth to dust. Okay. The other one is children's, and they only treat pediatric patients. They haven't been in existence for as long, and I can't tell you for how long. I really can't remember. But we've been in service for about 40 years. We're reaching our anniversary. I've been a nurse for 40 years, and I, previous to moving back to New Orleans, I was in Cincinnati, and I was at the Cincinnati Children's Hemophilia Treatment Center there for 8 years, and May would be 11 years here. So I've been with this community quite a bit. When I moved back home, I knew I wanted to stay with this community, and the only HTC Hemophilia Treatment Center at the time was Tulane. So I went and interviewed, and I got the job. I drove down all day on a Thursday for 14 hours and started work on Friday for orientation. So I've been there ever since. On the next page, we have our team, which this whole PowerPoint has to be updated, and actually we're going to work on that today. We have a lot more team members now. Our center is growing by leaps and bounds. We're getting referrals all the time. And I think that's because it's not that there's more people out there with bleeding disorders, it's that people are getting more knowledge about this, they're getting educated, and they're hearing more, and so they're going, oh, I wonder if that's what I have. So they talk to their doctor about it. And also we're doing outreach with pediatricians and emergency rooms in rural areas and doing in-services and stuff. So people are getting the information, and then they're coming in to get ruled out and see if this is what's going on with them. So we're just going to talk a little bit, like I said, about the basics. So what is hemophilia? It's a rare bleeding disorder. It is inherited, okay? It doesn't mean that the person is going to bleed to death. Okay, that's a myth that a lot of people think about a person with hemophilia. We don't use the terminology hemophiliac, okay? We don't use that word anymore. We say he has a bleeding disorder, because it's like you're labeling the person. And his bleeding disorder is not who Jordan is, right? He's Jordan. He's a normal baby. He just happens to have a bleeding disorder, just like an asthmatic. We don't call him that. He has asthma, okay? So we don't want to label him. And I know Alexis said sometimes it's easier just to say that, but that's
because we're learning. So it's easier to just say he has hemophilia, and let's do some research.
Well, he does have hemophilia.
Yeah.
But you don't want to say he's a hemophiliac.
Yeah.
Yeah. So how does blood clot? Okay, so at the top of the slide, it shows you a person without a bleeding disorder. We have an injury to a vessel. The vessel normally constricts, right? Because it's going to try to stop that bleeding. Then platelets rush to that area, and we have a thrombin burst, which thrombin is like it's like a fibrin. It's a mesh. So the way I think of it is, have you laid concrete before? You know how we put rebar down what does the rebar do in the concrete?
Stabilizing.
It strengthens it, right?
Yeah.
It pulls it together. So that's what the fibrin is. It's a mesh that pulls that clot together. So you see, they can form a clot, and it stabilizes. So you see how the person has stopped bleeding here. And on the pictures, like with the dominoes, that's what I call them, you see they're not missing anything. You see at the top, they're all there. You push one down, like when you're playing dominoes, and they all go down, right? So that's what happens at the top. That's what happens for me. I don't have a bleeding disorder, okay? Now, a person with the bleeding disorder on the bottom, they have the injury to the vessel constricts, the platelets go to the area, right, to form the clot. A person with hemophilia can form a clot, okay? And they get the thrombin, the mesh, okay, that goes to that area to stabilize the clot. Since they're deficient, he's deficient in factor 9, okay, so you're either deficient, meaning you don't have enough, or he's like totally absent of it, and he does not have any because he's severe. So he has 0 factor 9 circulating in his bloodstream, okay? So if you look at the picture with the dominoes at the bottom, you see on the top row how it's short. So it's either short because he has some, but not enough, or it's either missing. So for him, it would be missing, right? So then when you push the dominoes, you see how it doesn't finish off the rest of the dominoes going down? It's because he's
So
has hemophilia.
people with hemophilia can form a clot, but he cannot because
No,
he's completely.
you can
So
form a
he's
clot, but
severe.
it's just weak.
Okay.
You know,
So it's just
so
severe.
it depends on what his level is, and we're gonna go over that, the severity, on how quickly he's gonna bleed, okay, once he has an injury, all right? So did anybody have any questions about this? Do you understand kind of like the concept of what we were, yes? Okay. Okay, so we just went over that, how does blood clot, it's just a little bit more intense, the picture there. So is all hemophilia the same? No, it's not. Okay, first of all, I forgot to tell you, there's 2 forms of hemophilia that we're talking about today, okay? We're gonna focus on hemophilia B because that's what Jordan has. Hemophilia A, which is factor 8 deficiency, and hemophilia B, which is factor 9 deficiency, which is what he has, okay? So if you wanna remember those 2, the way you can remember is A comes before B, 8 comes before 9. So A is 8, B is 9, okay? So they have different levels of severity, 3 different levels of severity: mild, moderate, and severe. Severe is less than 1%, so that's 0, right? 0 circulating factor 9, that's him, okay? Moderate is 1 to 5%, so he has some circulating factor, but not enough, okay? Mild is 6 to like 40%. Normal is like 50 to 150%. Okay, so he's like at the bottom, right? He's the most severe that he can be. He has no factor 9, so that's why we have to replenish, we have to replace, not replenish, we have to replace his factor 9 into his system, and that's why Jordan is now on prophylaxis. We call it prophylaxis prevention, right? And I would say like prophylaxis is like when you wear a condom, right? If you don't want to get pregnant, right? Or you don't want to get diseases. It's a prophylactic thing that you do, right? So now we're giving him his factor 9 prophylactically. We call it prophy. You'll hear the word prophy once a week. He's on a long-acting factor, and we can go over that. And he comes into the clinic right now. He's getting it peripherally in his little veins, and right now that's working out, but I know it's starting to get a little bit more difficult. The sticking, it's not always just one stick. I think it's been like 2 or 3 sometimes. So I think Alexis is looking into possibly, and Chris, possibly getting a Mediport, right? We'll go with that as well.
Is that why, basically they draw his blood every time to see the level that he's at?
No, we don't draw levels every time that we give him his medicine, but we did draw levels this past Thursday when he came in, because we want to see, since he started, I think that was week 8 of his week 7 of his treatment, because we've only seen him since February, okay? So then we started him on prophylaxis, so he just had his 7th treatment on Thursday. We're drawing his level, we drew his levels then, because also if he has surgery, we want to know how long that medicine and what level he's at with that long acting. He gets it once a week, so every 7 days, right? So we do what we call a PK study, pharmacokinetic study, how long after did they draw his labs?
They didn't do it after, they did
They-
it before.
they just did it
They're gonna
before?
do it next time.
Okay, so they're gonna do it after the next
maybe.
time? Okay. So usually what we do is we draw a trough, which is the lowest level that he could be at. So that's why they drew his blood right before they gave him his medication, because since he was due for his medicine on Thursday, that's the lowest level he's gonna be at, right? Because once we give him his medicine, then his level's gonna go up of his factor 9. So then, she said they only drew the pre, the trough. So next week, they're probably gonna give him his medicine and then draw, maybe have her stay, an hour or two, I don't know how long they want you to stay. Yeah, and then they'll draw a level again to see how high he's rising, because if he has surgery, we wanna know where he's at, so we can make sure he's protected and he's not gonna bleed with the surgery, okay?
That explains.
So basically, I was still getting baseline spinning right now.
Right.
Yes.
Yeah.
Cause he's still bruising.
Yeah.
too.
Yeah, so you see, and right now he is, I know he's like, right now the medication is always based on the weight. So as the baby grows, like his dose is gonna go up, okay? We have some big patients and they're on a lot of medicine. And I don't know if Alexis told you already, but this is like extremely expensive medication. We call it liquid gold because it is very, very expensive. And it actually is, if not one of the most expensive medications that you can be on for any diagnosis. It really is. So,
We got $1 million baby.
yeah. Yeah. I remember when I was at Children's, we had a teenager, he had never been circumcised and he wanted to get circumcised. And he had an inhibitor. So, and I'll tell you what an inhibitor is, that we had to use so much factor on him to make sure he didn't bleed. And the doctor called him, he said that circumcision probably cost over $2 million. Yes. It was, because he was a big kid, like he was like a football player, not a football player, but he looked like a football player, He probably weighed 250 pounds, and it was a lot of factor. So, okay, now with the different levels of severity, so here it says, is all hemophilia the same, all the different levels? No, they're not. We just went over the numbers, right? You can't just go by the numbers. Just because Jordan is severe doesn't mean he'll always bleed, like he bleeds like a severe. And just because you're mild doesn't mean that you bleed like a mild. And by that I mean, we have patients that are mild, that bleed a lot, and we have patients that are severe that hardly ever bleed, okay? So with mild patients, you usually bleed after you've had some kind of trauma or surgery, okay? And you may not be diagnosed until adulthood. Maybe you get your wisdom teeth out, or maybe you had some kind of surgery and then you started oozing and then they had to take you back to the hospital and you wouldn't stop bleeding and you needed a transfusion because you didn't know that you had a bleeding disorder, okay? Not everybody knows their family history, and not everybody, even though you have it in your family, not everybody knows that they have a bleeding disorder in the family. That's what I should say. Moderate, you bleed after injury or surgery as well, and then you can have spontaneous bleeds. By spontaneous, I mean that you don't have to have an injury associated with the bleed. Okay, so like with Jordan, he's severe. He doesn't have to have an injury associated. He can have spontaneous bleed. Like we have patients that they go to sleep and they're fine, and then they may wake up in the morning and they may wake up with their ankle swollen and they have an ankle bleed.
Is that what we look for, swelling and
so
bruise as well?
yes, I'm gonna go over the
Okay.
signs to look for so you know exactly what to look for, okay? So like I said, everybody's individual, right? You can't go by the numbers. It's not just, okay, you're severe, you're gonna bleed, you're mild, you're not gonna bleed. It doesn't work that way, okay? We already went over the types of hemophilia. Hemophilia A is more common, and it actually tends, like those patients tend to bleed more severely. So he's 9. And it's less common, okay, which is good. And more patients are affected than these numbers here. These are old numbers, so really there's a lot more patients that are diagnosed nowadays, okay? Okay, so the genetics of the hemophilia, I'm not really gonna go over that a lot, but it's X-linked, which means it comes from the mother, okay? Females carry the gene. Now, you cannot have a family history of hemophilia, and you can have a baby, and you can have hemophilia. because there can be some kind of mutation that goes on, genetic mutation while they're in utero, and they have, like, we do extensive family history, and you can't find anybody that, they used to call them a free bleeder. We asked them that. Have you ever heard the word free bleeder? Do you have anybody that had a lot of bruising, that had a lot of, severe nosebleeds or mouth bleeds, that they were reported for child abuse because they were so bruised up? That used to happen before, okay? People would go to the grocery store with their kids and they were bruised from head to toe, and people would think like, oh my God, they must be like abusing this child. Or they take them to the emergency room, and the emergency room would actually report them to child services because they thought the child was being abused, and it was just that they didn't know that he had a bleeding disorder.
Even him having the diagnosis of hemophilia, his doctor reported his bruises. And I was like, that's fine. Please do it.
Yeah.
Just because, I get it.
Yeah.
Sherry's oldest nephew has hemophilia A, the most severe kind as well, so he's 18 now.
He's done great. That's good. Okay, so if you're a man and you have hemophilia and you have a daughter, if you have a daughter and like a man, okay, has hemophilia, he has a daughter, that daughter automatically is an obligate carrier, which means that she can be either symptomatic or asymptomatic, but she is a carrier, okay? So now she has the possibility of passing that down to her children, right? So here it shows you on the diagrams, like the chances of, how you can pass it on to your boys and girls. So if you have any questions about that, we can go over it.
So Jordan will definitely pass it to a doctor.
Yeah, that's why when we know somebody's pregnant, we'll be like, what are you having? You know what I mean?
Yeah.
What are you having? We're like,
But if he has a son, they won't have it.
right. I know. Because it's carried by the
Because
X.
it's carried by the female.
Okay, so types of bleeds. We have all different types of bleeds. Bruising is a bleed, right? Bleeding underneath the skin. Superficial cuts and bruises, mouth bleeds, nose bleeds. You can have a joint or a muscle bleed. So these last three, we're getting into the more severe bleeding, okay? But I really shouldn't say that, because we've had babies that have mouth bleeds and they just keep like he bit his tongue, right? He bit his tongue.
Mm-hmm.
One baby I remember, he bit his tongue, or no, he fell and he broke his little frenulum, and he kept oozing and bleeding, and he ended up being in the hospital because his hemoglobin and hematocrit dropped so much that he needed to be monitored closely and actually had to have a blood transfusion because he had dropped so much. But so yes, those can be severe as well if they're not appropriately treated. Joint muscle bleeds are big, limb-threatening bleeds, and life-threatening bleeds, and other serious bleeds. And we'll go over examples of those, okay? So you'll know what's really, really important to know. Does anybody have any questions so far?
No.
Okay. So early recognition of bleeding. Just watch for general signs, okay? Be aware of his behavior. If he was happy, he's a happy baby, he's playing, you see how he's walking right now, he's pushing the toy, and then all of a sudden, he's just kind of like really fussy, or he's not walking anymore, and he's not pushing the toys, he's just kind of not doing anything, yeah, just like not happy, like this. Or if you notice that, you see how he's walking fine, all of a sudden he's limping, or he's guarding one of his extremities, if he's not using one arm, and if he's limping on one leg and guarding the other, okay? That could be a sign of a bleed as well. You can look for swelling, okay? You don't always see swelling right away. He knows, like as he gets older, he's gonna know when he's getting a bleed because he grew up with this, okay? So we have taped, just like I did an in-service for Alexis on Wednesday, and I also did one on Thursday morning and Tuesday morning for a correctional center, because we have a patient that's in the correctional center, okay? So I did an in-service for the nurses, and I said, if they say to the guard, I'm getting a bleed, or I know I have a bleed, or, like I can feel one coming on, they're not lying to you, okay? Because I said, I'm sure the inmates probably do things to go into the infirmary or whatever they do, and I said, but you have to evaluate the situation, you need to call us. Like what I did was I had the nurse bring the inmate into the room. I was able to speak to him on speaker, because I can't have a conversation with him just by myself. And so she was able to hear everything that I was asking him. And, yeah. You want
What are you
this?
doing, monkey?
Yeah. Look at him, he's smiling. He knows what he's doing.
Cause he knows.
Yeah. Yeah. So I was able to ask the questions directly to him, and then I found out that he really was having some issues. Okay, so I told the nurse at the correctional center he needs to go to the hospital. They were in Baton Rouge. I said he needs to go to New Orleans to UMC. He needs to be transported there, and he'll probably be admitted. And sure enough, he was admitted for like almost a week. He had an ileoceles bleed, which is a big bleed, and I'll talk to you about that. Okay. But you see, just getting that direct communication with him and me knowing what to ask him and not going, can you ask him this? And she's saying, oh, he said this, and coming back and forth, I was able to figure out that he was having.
What do they describe that it feels like?
Some of them describe it as it hurts,
Okay.
okay? And it just depends on the age. He may be just like pulling his elbow
Yeah.
and maybe playing, but not using his arm, Or all of a sudden, he's not playful anymore, and he's irritable, or he's crying, okay? Or he's limping, or they may say, or feel the extremity. It may feel warm.
That's what
it
we
may
feel,
feel.
like
Sometimes
fever.
you feel heat. Sometimes if you like palpate with your fingers and you push in, it feels spongy, and
Okay.
that's the blood that's in that joint, okay? That feels like a sponge.
So it's like creating a little pocket.
Yeah, so you get blood in your joint or in the muscle, which is not good. It takes one bleed in a joint to start creating damage in that joint. So one bleed in a joint, and that's like the process starts, okay? And that actually makes that joint more susceptible to bleeding. Okay, so if he has one bleed in his knee, that means that knee is more susceptible to having more bleeding, okay? Because he's already getting some damage to that knee, all right? Even though he's on prophylaxis, and even though we treat the bleed, if there's blood in a joint, what happens is that blood is kind of like, I call it like Pac-Man, okay? The synovium that we have, the cushion in between our bones, the cushion, right? So you're not bone on bone, right? So the blood is eating that cushion away. And if a bleed is not aggressively treated right away, okay? We have patients that wait a week. My knee's been swollen for a week. I don't know why. We tell them all the time, either they're busy or they just don't understand, or I don't know what it is, but a week later, then it's gonna make the process of treating that bleed a lot longer, and you're gonna have to use a lot more factor. Where if they would have called us that day, they had the injury, or that day that they felt the tingling, that's another word, like it's tingling, or it's burning, or it's aching, or it feels like stabbing. Everybody feels a different sensation. We could have given them a treatment right away, and sometimes we only have to give them one if we get it right away. But if we don't, then we have to treat at least 3 days in a row for a joint bleed, and sometimes it's longer depending upon how bad it is at that point. Okay? So it ends up costing a lot more. You may end up going to the emergency room, and you may end up being hospitalized. So then that's a lot higher cost to your insurance company as well. And a lot more aggravation for you because you're missing work, right? You're missing school, whatever the case may be. You're missing on being able to do the things that you love to do in your life. So, the other thing, listen to the patient, listen to the student. Be supportive. If he's saying something, don't be like, oh yeah,
Like take it serious.
yeah. Because we're talking about like listen to the student because the teacher may think he was trying to, Okay. Bruise clues. Okay, so sometimes the way we find out a baby has hemophilia is when they start toddling around. Okay, well, first of all, the first thing is when they do the PKU in the hospital, they do the heel stick, right? Sometimes that might keep oozing and oozing, but it oozed for him in the NICU, right? They kept sticking him.
Yeah,
it's healed. Yeah. So that wasn't a red flag for them, right?
It was.
It was. He had already had his circumcision.
Yeah.
He had
No,
already
he
had it.
hadn't had it
He
yet.
hadn't had it yet?
No, they didn't do it because he had jaundice, so they waited till
Okay.
the last day, but it did raise, like they asked us about the family history, and we didn't have it.
Yeah. So you see, they didn't pursue like testing or anything because she was like, no, we don't have any, history, because she didn't have. So, but one of the ways that we find out on a lot of kids that don't have a family history, that they don't know that they have a family history, is they do the circumcision, right? And they go home, it's issued on the day before, the day they leave, and okay, wrap it up, go, it's gonna bleed a little bit, you may find some dots on the diaper, change the dressing and all. Well, it just keeps oozing and oozing and oozing. And instead of just a little dot in the diaper, there's a lot more bleeding in there, okay? Or it may just be that instead of just bleeding for a couple of days, it may bleed for 2 weeks, okay? And then the mom says, I'm taking him to the pediatrician, he shouldn't be bleeding like this. And then the pediatrician will be like, let's do some testing, or let's send you here to see, what's going on. He didn't bleed. He didn't bleed from his circumcision. So that's pretty uncommon, especially since he's severe. But like I said, severes bleed less than, severe 9 bleed less than severe 8s, okay? And he might have just had enough circulating factor in his system from birth, you know what I mean? So, now with hemophilia, bruises tend to take longer to heal. Okay, so where you might have a bruise and it may take 2 or 3 days for it to start, it turns yellow and green, it starts kind of changing colors on you and going away. It may take 2 weeks for him or longer. You feel that hematoma, that little knot underneath, and that may take longer to dissolve with him. Now, if he has a bruise and you notice that it's getting worse, okay, or that it's pretty big, you want to give us a call because we want to see what's going on there, okay? Sometimes all it is that he's growing and we haven't seen him, and he may have just gained not a lot of weight, but some weight that we have to adjust his dose and things like that. Now, I do know Alexis said she noticed that when they would pick him up, you could see like the fingerprints, the handprints on his body of where you picked him up. And so how old was he when you noticed that?
His first bruise I noticed was 5 months. And it was one whole thumb hematoma under his rib.
That was just from picking it up.
But we didn't know that at the time. But definitely.
Okay, so here's some long-term complications if you don't recognize a bleed early on, or if it's not treated aggressively and right away, okay? So we don't see this a lot anymore just because in this day and age, patients are starting out prophylaxis right away, okay? Before, they didn't have medication for it. They got cryoprecipitate, they got blood transfusions, you know what I mean? That didn't really do the job, okay? So we had a lot of patients that would bleed to death because they were bleeding internally, right? And they weren't getting treated appropriately. Then we started with all the products coming out, it was short term. They didn't have long term acting factors at that time. It was like 1 or 2 products, okay? Now there's like a ton of products for both hemophilias for you to choose from, and you have options. Before, you really didn't have a lot of options. With insurance, we used to have insurance caps, right? So if you had a diagnosis like this, you reached your cap like really quick, right? Because it's so expensive. Like you couldn't get a lot of the older patients. When we try to put them on prophylaxis now, they're like, no, I can't do that. Because in their mind, it's still the shortage of that product being available to them, and they think about the insurance caps. They just can't get over that they didn't receive prophylaxis when they were a child, and those are the patients that you see that walk around like they look like they're crippled. They either have a cane, or their legs are crooked, or their elbows are like this, or their arms like this. Because what happened was they were having bleeds, and that's what you call a flexion contracture. They don't have full range of motion of their extremity anymore, okay? Their arm might be like this forever. We have patients that can't brush their teeth. They have certain things to use to button their clothes, because they can't bring their arms up like this to brush their teeth by themselves and all that.
And that's from ignoring the joint bleeds.
And that's from, these are older patients
Yeah.
that they didn't have
What we have
access to the, yes.
Okay.
So I was telling Alexis, if you're gonna be born with hemophilia, this is the time to be born with hemophilia, okay? Because you have access to medication, you don't have insurance treatment, and not having insurance is not a reason that you don't get your medicine. All the pharmaceutical companies, most of them have compassionate programs, that are there for if you have a job and you lose your job and you have a gap with your insurance, right? Because a lot of times you have like a waiting period or something. If it's 3 months, well, he can get his medicine for 3 months because there are programs that will provide him with the medication for free. Okay? So, and we have patients that say, I can't come to clinic because I don't have insurance. We never deny anybody coming to clinic to pay for their doctor visit and their labs, ever, because we have a grant, and that's part of what we use our grant for, is being able to provide assistance to them so they can come in for their appointment. Okay, so everything is covered, all right?
Wouldn't this suck? I mean, to me, it seems like a real rarity. Just seems like the government would be more willing, you know, to accept people without insurance or with insurance. They couldn't.
You'd be amazed what the insurance
Pay for
companies are doing right now.
We are talking
not
about
pay
the
for
government, though,
Yes.
right?
Yeah, I mean, the government, yeah. And with insurances, what is happening is that, we were just talking about this at Hill Day, right, Alexis? That,
Yes.
that the insurance companies are trying to, the wording, I don't know the exact wording, but basically what they're trying to do is say that they will only cover this product for hemophilia. Well, it may be a product for hemophilia A, or factor VIII, where he has hemophilia B. So is that gonna work for him? No, it's not gonna work, you
But
know?
they're saying that's the
Or-
one that they.
Yeah, or they would say, this is the only one that we're gonna cover. Or they may say, we'll cover this one for factor IX, but that's not what is best for him, okay? Because the doctor has a recommendation to the family, but they tell them their options, okay? The parents are very involved in the decision. They can do their research, they can read about it, they can ask any questions that they have. But most of the time, the patients go with what the doctor recommends because they know that this one is gonna work better for them for whatever the case may be, okay? So, but the insurance companies are, just like out of control. And they try to tell us, the nurses, because he can be on this medicine for 5 years, and the next time we need a prior authorization, they're gonna call and say, does he really need to be on this medicine? Does he need it anymore? And you're like, yeah, he still has a bleeding disorder, he'll have it for the rest, you know, like, it didn't just go away, you know?
Right.
And, well, we want him to try this medicine now, instead of this one, we want him to be on this. And it's like, you're not a doctor.
Kickback from
Yeah.
the other one.
I don't know, but they're not a doctor, and these are non-medical people that are saying this to us on the phone. So it gets to the point where if the nurses can't get it, the PA approved with the doctor, okay, or the pharmacist that's with the insurance company, then we have to get a peer-to-peer. So then we have to get the doctor from the insurance company that speaks, and it's usually not somebody that knows about hemophilia. He may be, I don't know what kind of doctor, but he doesn't know anything about hemophilia. And so we have to get an appointment for that doctor to speak with our doctor. And do you know how hard it is for us to get our hematologists? I mean, they have meetings, they have clinic, they do research. I mean, they're travel, you know, they're all over the place. And then we have to figure out when are they available that we can get them on the phone together. And usually that works. But it's very, very time consuming, very time consuming. So the patient can get arthritis, right? He can get arthritis in that joint, just like, I don't know if anybody has arthritis in here. Does anybody have any joint, arthritis in their joints? Like sometimes they say you can feel the weather changing. Yeah, like, oh, it's gonna rain, I can feel it in my knee. You know, you hear people saying all the time. Well, they get arthritis, okay, and that's called joint arthropathy. Pain in the joint, and they get arthritic pain, so they're in pain, right? So what happens with, what did I say, what happens with the joint bleed? What happens with that blood? What is it doing when it's in a joint?
Yeah, that's an obvious.
So what does that mean if it eats up all the synovium, which is the cushion? What does that mean?
Yeah.
So then you end up like this.
Bone development.
So when they say they're in pain, they're in pain.
Yeah.
Okay, so we have, many years ago, when I first started with Tulane, 11 years ago, I came from working at a pediatric center, but we went into teenagers, and then sometimes they were still adults because they didn't want to go away because they had the same doctor since they were a baby. But basically dealing more with pediatrics. A lot of patients here were addicted to narcotics because they would order narcotics, and I was like, oh my God, I came from pediatrics to where we never used narcotics to a place where I felt like that's all I was doing was filling out prescriptions because they were already signed by the doctor. And I was like, I just so didn't feel comfortable with that. We don't have that anymore. If we have a patient that has an issue with narcotics, we send them to pain management. Pain management deals with the drugs. They test them, they do the urine test. If you fail your urine test, they fire them as a patient, right? Because they've signed a contract and they know what they have to do. And
I know about that all too well.
yeah, so it's hard, and it's hard to find a pain management to take care of our patients. For any patient, it's hard to find them in the city, or in the state. And sometimes it won't take them because they know they failed another program. So then it just kind of snowballs, Okay, muscle arthropathy. What does that mean? You're going to see a picture in here later on. One muscle's really big, the other one's really small, okay? The other one has a bleed in it. But then what happens is that you get muscle wasting, okay? You get muscle wasting when you have a bleed because you're not using that extremity. We tell them to rest, okay? They can't be active. So that's why we're always trying to prevent this from happening so we don't have these issues later on. That muscle wastes away, and so it's always going to be smaller than your one that's okay, that's normal, okay? You can get anemia from the bleeding. Like I said, you may need a blood transfusion. This is a big one, compartment syndrome. If you have a bleed in your forearm or in your calf, okay? Those are areas that have a lot of nerve endings in there. If you have a lot of blood in those areas and you have a lot of swelling and it's swollen, okay? Sometimes the skin looks shiny, right? Because there's a lot of swelling there. That's all that blood that is in there, and it's compressing on those nerves. So what happens if you're compressing on those nerves in this area and this area? What's below it?
Your extremities.
Your hand and your foot. So you're cutting off the blood supply to your foot and your toes, right? And your hand and your fingers. So if that is not addressed, you could have to amputate your hand, or you may lose some fingers, and we have older patients that have that, and they have very ugly scars right here and here, because they went in and they just like tore it up, to release that pressure. And we have people that are missing toes, So that should not happen now.
Yeah.
Okay? But if you ever see any swelling in that area, make mom or dad aware of it right away. Okay? Pseudotumor, false tumor, not a real tumor. The example I gave was we had a teenager who had a ball attached to his forehead. It looked like it was pretty big. It was bad. And he came in, and I don't know why they waited so long to come in. Okay, I don't know if they were busy or what the deal was. They thought it was going to go away. Well, the doctor looked at the teenager and the mother and said, "I don't know that I can fix this." So what she had to do was give him very high doses of factor aggressively, like every day. He was getting factor, very high doses. Eventually it dissolved and it went away, but it might have not because it was there for so long and it gets like hard, okay?
It calcifies almost.
Yeah, but he was a teenager.
Yeah.
And he was a boy, and I'm like, what? Like, why wouldn't you be like, Mom, like this thing is huge, I don't get it, but that happened. He got lucky and it went away. Okay, so we went over this right here already, what happens in a joint bleed. Okay. It may be limited range of motion, it may be pain, it may be swelling, it may be heat. It's different with everybody.
Could be bruising.
It could be, but it doesn't necessarily mean it has to be bruising. So what are the most common areas for bleeding? The most common are the ankles, the knees, and the elbows. But you can also have them in your toes. We have patients that have bleeds in their toes, in their shoulders and in their hips. The hips is the area that I was telling you, the patient that was incarcerated that I sent to the emergency room, and he ended up having an iliopsoas bleed, and you know what I'm talking about. It's like the biggest muscle here, and he had a bleed in that area. He had a bleed in that area months ago, and that's the one that he waited a long time to come in. He was in the hospital for almost like 2 months. Like, it was a long time. It was a big bleed. Well, then it reoccurred, and I don't know. He says that he didn't have any kind of injury, but it may just been that now that area was more susceptible, right, to bleeding. And he got another bleed in the same area, and luckily we got it earlier on. So he was only in the hospital for, what did I say, like almost a week or something. Okay, so this is what we went over already. What are the long-term effects of joint bleeding? We went over that already. So how is hemophilia treated? This is for, we won't go over Hemophilia, which is factor 8. Okay, we'll just go over what Jordan is on. So there's short-acting factor, there's long-acting factor. Okay, they still don't have the factor 9 yet. That is subcutaneous injection, but I'm sure it's down the pipe. Okay?
And would that be like more like an insulin injection?
Yeah, it would be a sub-Q injection. Yes.
So something
Very
that we
tiny
could have
needle,
on hand.
You can
that
use
we
it.
could-
You know, yeah.
So we don't have that for
We
him.
don't have that yet. We do have that for hemophilia A, but and obviously because it's more common, right? There are more patients, but I'm sure that it's coming down the pipe. So short acting. What is the difference between short acting and long acting? It's how long it stays in your system and how frequently you have to treat. Okay. So if you're on prophylaxis, like I told you, we do the PK studies after they've been on the medication for a while. We'll draw a trough, which is when they're at the lowest point before we give them their medicine, and then we give them their factor, and then what we usually do is do like a 1 hour, a 4 hour, we may do like a 24 hour and a 48 hour, just to see how much factor they have at 24 hours, how much factor they have at 48 hours, and we can figure out, so how often does he need it based on his levels, right? It's not the same for everybody. Some people have a short half-life, which means that the medication doesn't last as long in his system. So then he might need to get treated more often. So the blood work that we drew on Thursday and then the blood work that we draw this Thursday is gonna tell us a lot more information because he's growing, right?
Yeah.
And for his medication right now at his age, the range for prophylaxis is, I think 30 to 55 units per kilogram, and he's at 55. Okay, so he's at the highest point. So we'll see what his levels are and then see if we need to increase it at all, or at least we'll know for the surgery, if he has surgery. If he has surgery, in 24 hours, where is he gonna be? Okay, or in 12 hours, where is he gonna be?
So even though he's severe, there may be a difference of how long it stays in his blood compared to someone else. who has
Everybody's
severe-
different. Yeah, and then I'll go over what an inhibitor is. An inhibitor is an antibody that your body develops against the factor. So if he gets an antibody against his Aldelvion, which is the name of his medication, we may not know it yet, okay, because we always draw labs when he comes in, like for his comprehensive visit, but we see him more often because he's a baby and he's growing, right? And we're doing education, and you know the parents are learning, and we're watching him closely to see how he's doing with his meds and stuff. So we see him probably like with the doctor, probably every 2 or 3 months. Okay, but right now we're seeing him every week, but just with the nurse, okay? If Alexis and Chris start noticing, oh look, he didn't have any bruises, now all of a sudden we're seeing the handprints again, or he's fallen down and his knee's bruised and his shins are bruised, you know, and that's not happening right now, then it may be just that he's grown and his dose needs to be adjusted, okay? Or it may be that he's developed an inhibitor and maybe the factor's not working for him as well as it was before. We do not want that to happen, okay? We don't
And
want
there's no telling whether.
there's no telling. You are more susceptible to developing an inhibitor with the first 50 infusions that you get.
Okay.
It doesn't mean that if he's on it for 2 years, he can't develop it then. Yes, you can, but he's more likely to develop it in the first 50. Okay, so we watch him really close. What was I saying about the treatment before? Oh, the long acting and the short acting. So short acting, usually with the factor 9 patients, they're on infusions at least twice a week. Okay, if you have hemophilia A, it used to be 3 times a week. Okay, for the short acting. With hemophilia B, factor 9, the long acting, he's on Aldelvion. We have patients that are on Aldelvion once a week. We have patients that take it once every 2 weeks. We have patients that take it once a month. Okay, so as he grows, we're gonna be checking his levels, right? And he may get to the point where he's once every 2 weeks and not every week, okay?
Okay.
But it just depends on what's happening with him, okay, and how the medicine works for him. Anybody have any questions about that? No? Okay, so here we have how is hemophilia treated. We have patients, that's me years ago with some of the kids at camp, teaching them how to self-infuse, and I always offer myself for them to practice on me before they practice on, they do themselves, so they can see what it really feels
So
like.
there would be how much time we could give it to him and he doesn't have to go to the center to get it? Okay.
Yeah, mom and dad are usually the first ones to, like, they'll learn before he does,
Yeah.
if they end up going, when he doesn't have a port anymore and he's getting his medicine peripherally, okay, in his vein with the needle, the parents usually do that, we teach them if they're open to learning, okay, sometimes they're like, I can't do that, and you just teach them what you can teach them, and you get a home care nurse to go out, or there might be a nurse in the family or somebody that can give them their medicine at home, so they're not constantly having to come into the center, to the clinic. We try to make it as convenient and, for you to have just as normal of a life as you can, because you can have a normal life, it's just, right, this is just gonna be part of your routine, yeah.
Being aware of it.
Yeah. So, and then when he gets his port, they're gonna learn how to access his port, right?
Yes.
Yeah, she's gonna learn, and dad's gonna learn probably, and it's good to have both parents if we can, okay? Sometimes there's not another parent, sometimes the other parent's gone all the time and they travel a lot. Or the dad's really needle phobic and he's scared of needles and he doesn't want to have to, I'll hold, but I can't do the actual, accessing of the port. That's fine, but at least you have two people. But it's nice when you have both parents if they want to learn, because if Alexis goes on a trip or something, or she wants to go away with the girls for the weekend, and he's not due for his medicine, but he falls and he has an injury, well then he's going to need his medicine, right? So then dad can get somebody to help him hold, and then he can do it, right? Yeah, you. Yeah.
He just said that once a month, and we would be like, haircut day.
Yeah, so also with the surgery, sometimes what we do is, since he's on a long acting, he may get his long acting right before the procedure, but then he may be on a short acting after the procedure, because you can test the levels more accurately and you know what's happening right away with the short acting factor versus the long acting factor. You see what I mean? We have more control over where we want to have him. So if we want to keep him at 80 to 100%, where right now he's at 0, right? So 80 to 100% would be him being protected from bleeding. Okay, so that's where we want to keep him after the surgery, during the surgery and after the surgery. So he may get Aldelvion before the surgery, but then I don't know if they're planning on giving him like Benefix, which is the short acting factor 9 after the surgery.
We haven't had.
Yeah, so we haven't talked about the plan yet, so we'll see if that's what they want to do. So what's the goal of treatment? Well, recognition. Really the treatment is, let's prevent it first, okay, right? Let's keep it from happening. Early intervention, treat right away, recognizing it right away, getting the word out, calling right away, not being like, oh, it was 2 o'clock in the morning and he fell over the tray and hit his head, but I don't want to wake up the nurses because, they're tired. Like, we have a nurse on call 24/7. We all take turns. We have 5 nurses that take call. I just took call a couple weeks ago. I go on a Monday morning at 4:30 when the phones go off, and if for some reason that's a holiday and the phones aren't on, then I go on Monday morning at 8, okay, because the office is closed. So at 4:30 when the phones go off, we're still there in the office working, but the phones go only on during 8 to 4:30. So if you call from 4:30 to 8 o'clock in the morning, or on the weekend from 4:30 on Friday night, evening till 8 o'clock Monday morning, or if you call on a holiday, or if we're all in a staff meeting or some kind of training or something, and the phones go over to the doctor's exchange, then you will get a nurse. You can get a nurse. A person will answer the phone. We don't have a voicemail. We have a person, a doctor's exchange that answers. If it's a true emergency, you say, I have an emergency. I need to speak to the nurse. They will put you on hold. They'll get your name, date of birth, who's calling the mom, and get your phone number. So if you get disconnected, they have your number. They call me or whoever's on call. Hey Jackie, I have a work phone and I have a personal phone. They call my work phone and they go, Jordan Hayes, his date of birth, this is his diagnosis. And a lot of the patients can't give you their diagnosis, or they give you the wrong diagnosis, but you know, we ask them, okay, that, we write it down, okay, you can transfer the call. So she immediately puts the call over to me. I don't say, just give me the number and I'll call her back. Like if it's an emergency, we get on the phone right away, okay? And then Alexis or Chris can talk to the nurse that's on call and tell us what's happening or ask the question they need to ask. And then we can advise them, okay, this is what you need to do, and then you need to get to the emergency room.
I think my main question is like, when do we know it's an emergency?
Okay.
Like, what type of
I'm gonna tell you what to look
Fall.
for, with different
Okay.
life-threatening bleeds and stuff like that. We haven't gotten there.
We
yet.
did have a conversation about this. So like, what if something does happen and she has to bring him to the emergency room? Is there some kind of forms or something like that she could just bring him into the emergency room and say, you know, I don't know anything, but his insurance pays.
Yeah,
Here's
do you
her
have an
thing.
emergency letter?
Yeah.
Okay, so the emergency letter is.
But I don't have one updated. I only had the one from him traveling.
Okay, so you only have a
I don't have
travel.
like a generic.
Okay, well, I can tell Nicole and she can make one up, or I can make one
Okay.
up for you. So it'll say, his name, date of birth, his diagnosis, okay, it'll say that his baseline level is less than 1%, okay, so he's severe. What we put on there is that, this is his medication, this is how often he takes it, okay? And we'll put on there how many units per kilogram he gets, so that if his weight is different from when we gave him the letter and he's gained a lot of weight, they can weigh him and see this is what he needs, okay? So right now he's on 55 units per kilo, okay, per kilogram. Well, if he's gained, 10 pounds and the letter's old, then they can figure it out and say, this isn't enough, we need to give him more, right?
So the emergency room has the factor.
Some emergency rooms have factor, and some of them do not have the factor you may be on, okay?
Yeah.
They may have factor 9, but they don't have what
And
he's
no,
on, yeah. So factor 9, short acting is better than no factor 9 at all, okay? But we try to instruct the family, if you're home or if you have access to your medication before you go to the emergency, we prefer for them to give it at home right away
Okay.
and then get to the hospital. Our motto is treat first, evaluate second, okay?
Because he
And-
can't have too much factor. Can he?
Yeah, you can.
You can?
Yeah, because you don't want him to clot, like a thrombosis, like get,
Like it will.
like you want him
make
to clot and stop bleeding, but his levels
You
can
don't
go
want
so
it-
high that he can actually have like
over.
like a thrombotic effect that he can actually have a clot, and you don't want that to travel somewhere, and cause a problem. You know what I mean?
Yeah.
Yeah. So then we say, okay, like if Alexis calls or Chris calls, and we'll be like, okay, did you give him his medicine yet? Okay, give him his medicine. Or when was the last time you gave him his medicine? And then we'll say, okay, give him his medicine and then get to the emergency room. Because at least we know he has the first thing that he needs, right? If he falls and hit his head, he hits, the concrete or something, this tile or whatever. Well, that's a problem because that's his little head, right? I mean, he could have a head bleed. And so by the time she gets to the emergency room, they get him to the emergency room and they triage him. And they, we call, and that's why we ask them to call us first before they go or while they're on their way to take him. Because we'll say, where are you going? We're going to Our Lady of the Lake in Baton Rouge. Okay, well then we call, we ask for the doctor, the emergency room physician. If we can't talk to him or they're too busy, or him or her, we ask for the triage nurse and we give them a report. And we'll say, we have our computers, we have to take them home every night, our laptops, so we pull them up. This is his name, date of birth, this is what's going on, he's on Aldelvion, this is his dose, the parents already gave it at this time, this is what they gave. So that's why, like, if you say, how much did you give him? Tell us what's on the box, like the actual number of units. We'll say, this is what he got for his weight, so he has his treatment. So then when they get to the emergency room, they can triage him and they can get their scans done and ultrasounds or whatever it is that needs to be done for that injury, okay? But we feel more at ease and the parents feel better because then we tell them he can't wait in the emergency room, he needs to be taken back right away. He has a bleeding disorder and sometimes they make him wait. It just depends, flu season,
Some people
whatever,
have never even had a hemophilia
Yeah.
patient.
Yeah. And they're like, yeah, okay, right, we have 50 people, yeah, we're gonna take them back right away. And they don't, and then the
Yeah.
parents call, and I'll usually call back and say, hey Alexis, this is the triage nurse that I spoke to, this is her name, or this is the doctor, so like when she gets there, she can say, the nurse called from the Tulane Hemophilia Treatment Center, she spoke with Tiffany, the nurse, and, she gave her report. Because they'll be like, oh, I don't know anything about it, oh, we didn't know they were coming, oh, you know, and it's like, that's why I get a name and I give it to them.
Would it be more advantageous if something like this happens to be like he has a bleeding disorder instead of saying hemophilia?
Yeah, that's what,
Yeah,
he has a
yes.
bleeding disorder, yes, he has a
Okay.
bleeding disorder. And so, and then we tell, like, say, they're not home and they don't have the medicine. Okay, so they just went straight to the emergency room, right? So she wasn't able to give them this medication. So then she goes to the emergency room. And then we tell them, you know, we'll say like, do you have factor 9, you know, blah, blah, blah. And you'll get familiar with the hospitals, you know, hopefully not too familiar, but, you know, Angela has actually, she's our head pharmacist. She's actually called around and found out what they have in their formulary, okay? And then, we'll be like, okay, let's say he has factor 8. Well, they have medicines that are for von Willebrand's, which is a different bleeding disorder, but it also has factor 8 in it, okay? So they may end up getting a medicine that's for von Willebrand's, but it also has factor 8, okay? So we just have to figure it out, like or
So
don't
they-
go there, go here, you
If
know?
they didn't have anything, but they did, maybe not his specific medicine, but they had something that had
Factor
factor 9, they can still give that to him?
They tell us what it is, and then we'll tell them how much to give. We'll say like, what's his weight today? And we'll base it on that current weight that day. Yes.
And wouldn't you typically like have a hospital or like an ER that you would like
So like
choose?
children's hospital,
Right,
If
like
we could get there,
on
that's
your
ideal
emergency
because
sheet,
Because
they
is
have
that the children's hospital that
Yeah.
has the other hemophilia
Like the,
center?
yes, but,
Yeah.
but you're here, right, or you're in Gonzales.
We're in
Right?
Gonzales,
That's
So it's
right.
like about 15 minutes
Yeah.
away.
That's how long it is, just 15
No,
minutes?
it's like you would
So,
identify.
what children's hospital are you talking?
I know, but
You talking about the children's or the?
Lake
Oh, I thought you were talking about New Orleans in like 15 minutes.
The big one.
That
So would the Lake Children's have?
So
I would
there's a
imagine.
hematologist there, and she said if anything happens,
They
call
have,
me.
they have it there. Okay, because I don't know myself specifically that they have it there, but they should.
Yeah, she said.
I would imagine Lake,
Yeah,
Yeah.
the Lake should have that.
yeah, because I know Our Lady of the
But
Lake,
we
a
were
lot of our
sure-
patients go to the adult patients go to Our Lady of the Lake. We should go.
Like she has a hospital that's like 3 minutes from her house, but I said, but if you get to that one and they don't have the factor, then it's literally wasting time to get to that.
Which hospital is that?
I think it's the general, Baton General.
Blue Bond?
No,
it's
it's
on
right on, they
73.
opened like a, emergency room right by my house.
On
Oh, no.
Like
73.
kind of like
Oh, Ascension? No, that's a standalone ER. They most likely will.
kind of like an urgent
Yeah.
care sort of
It-
like.
Well,
yeah,
it's a
well,
hospital.
It's a full service emergency room. They don't admit,
Okay.
so they would send it to. They
Yeah.
would
They
send
could
it
give
from
him the
there.
Benefax and then he could go to children's.
But if she had
If they have it.
If they have it. Most of those little small ones.
don't have it.
Yeah.
And I mean, the more rural you live,
Yeah.
you'd be amazed. I mean, like they
Ours.
just never
That's
Yeah.
good about
Just-
that.
heard
just-
of it, or you know, you learn it in school.
Yeah.
Well, and
then
like
you never
mine,
deal with the patient.
I know you
So
tried to
just
find out
forget
from
it.
Gonzales Fire or whatever.
Yeah,
about
so they
putting
told
them on
us
the
to
list.
just call the paramedic, just call EMS and have them come to the house and give it to him and then take him to children's.
But like, you
Because
know,
I mean, sometimes like you know, it like they might be too. If it's truly an emergency, I mean, you know, it doesn't. You're not all cool and calm, and you know what I mean. I don't know how you. How,
No, we don't
you
know.
don't know how you're gonna react. Like you're the parent. Okay, at
Yeah,
this
we have
point,
no idea.
you know, yes, you're putting a needle in his chest and you're giving him his medication, but if it's
That's
truly
in
an
the
emergent
report.
situation, I mean, they may just be too like freaked out or nervous about it. And we don't want you to access his port if you feel that way, because then you could risk an infection, right? So, now, do y'all know what a metaport is, what we're talking about? Okay, so y'all know what it is, like underneath the skin?
I'll figure it out.
It's implanted. Yeah, it's round, it has, oh, I'm sorry, you had a question. I'm sorry.
No.
No, he had a question.
It's kind of a side point, but we used to carry a powder with us. It's called blood stop.
Uh-huh.
And for like an open wound laceration that was deep, would he benefit any from that?
Yeah, so
Before all of
did
the,
you say that it's deep? Is that what you said?
well, something that would require stitches,
But
you know, a deep
does quick fly
laceration.
work? I don't know if you're familiar
Yeah,
with
is
quick fly.
that the white, because I know.
Well,
that
now
patients
it comes in a bandage form now, so it's.
I mean, you can put it on
This
him,
was
but
a
if,
white powder.
Yeah, they make
Yeah, I've
it
heard
into,
people
it's
say
into
that.
a bandage now,
yeah,
like there's no more powder.
Like you can just
Oh,
put it
okay.
on, it's in the bandage and you just
Yeah,
like,
it's a
and it-
hemostatic agent.
yeah, and you can hold pressure on it, you know, you can put that and you hold
So
pressure
that's-
on it, but you're still gonna need to have the sutures. So if he ever needs sutures, you will need
He
medicine
uses
before
medicine.
his sutures are put in or during
So
that.
that's what she's saying.
And
you have
then
to
also
treat
when they're
and then
taken
you
out,
take it
because you're causing trauma into the area, so he's gonna be likely to bleed, so he'll need them when they get pulled out or whatever, you know.
Yeah, I was just referring to a first aid incident where it may be an hour before you can get to a facility.
Yeah, if it's just a scrape, you know, you don't need all that, but if it's a
Yeah.
gash, and you
Yeah.
know, like you can see, it's
Something
it's
deep tissue, yeah.
yeah, just like any person without a bleeding disorder, he's gonna need sutures. Okay?
Sure.
He's just gonna need his medication, alright? And then depending upon how bad the laceration was and how big and how many sutures and all, we may tell her, okay, give him another dose tomorrow, give him another dose in a couple of days or something, you know, just watch him.
But on the front end, say they were in the country somewhere. Yeah. And
Yeah,
Just wrap it up.
They
Wrap
make
it
it to
up.
one of these fabulous hospitals and sit in the ER for an hour and a
no,
half.
I know,
And
believe me, it happens.
I don't know how the powder reacts to a hemophilia.
No, it's, you can use
Same
it.
thing?
Yeah, you can
Okay.
use it, it's not any different. But like I said, we talk to the triage nurse, we speak with the physician, and then sure enough, the mom or dad calls us an hour or two later, I'm still sitting here, you know, and it's like, oh my God. That's why we tell the parents, you need to advocate for your child, right? He can't speak. They have to keep going up there and saying, look, like the nurse talked to the doctor, you know, they were told this, and if they're not doing that, she needs to call us back again and say, it's an hour, I've been sitting here, like I'm still waiting, you know, or he hasn't got his medicine yet. Because it's, I get it as a medical person to say, just give him his medicine first and then evaluate after that, but that's the way it is with them, okay, we need to get going right away. If we suspect that he fell and he hit his head, and he might have a head bleed, right, because we have to think that he might have one, then the first thing we need to do is get that medicine in him, so we don't cause any kind of, you know, damage, any bad things to happen, you know, because of that, okay? So that's where mom and dad come in and they need to, you know, you don't need to be ugly, but you need to be firm and you need to say, this is what he needs and I need to call the office again, we need to talk to the doctor and we'll call again. But sometimes it works and sometimes it doesn't. You know, we're on the other end of the phone, so we can't, all we can do is try and all they can do is try as well.
He's trying to crawl in.
Okay, so first aid, normal first aid, you know, for just like, oh,
Like
you know,
scrapes
scrape
and
his
stuff.
knee, you know, whatever, yeah. So before it used to be rice, right? Now it's price, they added a P, prevention. Okay, prevention first. Then if there's an injury and he's holding his little elbow, or it looks swollen to you, or it's a little red, or you think he might have fallen because you heard something, but you didn't see him fall. You don't know if he hit his head, right? Okay, so what we're gonna look for. There's signs and symptoms for every type of bleed. A head injury, we're gonna start from the top. A head injury, does anybody know if you have an injury to your head, what kind of symptoms you can have if there's a problem with a bleed, a head bleed?
Dilated pupils, or one's dilated, one's not dilated, disorientation, wobbliness,
Redness.
red.
Are you
If
talking about
he
if
hits
it's
that,
red, if it's red, like a bruise? Yeah. Or if you see like swelling already, you know, if you see a golf ball size, or if you see
eyes
clear,
being able not to focus.
if you see clear fluid from his nose or from his ears, and we're not talking about
Snot.
boogers, you know, snot, yeah, mucus. We're talking cerebral spinal fluid, okay? If he can speak and he's old enough and you say, what day is it today, or where are you? And he doesn't know where he is, okay? Or he doesn't know his name, or, you know, things like that, if he's disoriented. Like what's your name? I'm sorry.
Anastasia.
Anastasia. Like Anastasia said, that he's like walking fine and then all of a sudden he looks like he's drunk.
Dizzy,
you know what I mean?
yeah.
Yeah, dizzy and can't walk straight. So those are some irritability. Irritability is a big one, all right? And then the other one is drowsiness for him, like now, or anybody that has a bleed. If he was fine and it's not nap time, and he already had a 2-hour nap or whatever, and he should be up till whatever time, and it's not that time right now, and all of a sudden all he wants to do is close his eyes and go to sleep, well then that's a problem, okay? Cause that means that there's most likely something going on, okay? So those are the things that we look for. And if he falls and you don't know if he hit his head or not, you just assume that he did, okay? Let mom know or, you know, whatever, and she think or dad, and they're gonna call us and let us know. What's that?
I thought you might have taken another chunk out of the football.
What you see here, the difference that I told you in the size?
Yeah.
You see?
I think the spontaneously scared me the most versus like watching him and him fall.
And once we get his levels and we figure out what is best for him as far as his regimen, you know, how often, he may not.
Yeah.
You know what I mean? If he has really good protection, but, you know, he may have done something the day before that mom and dad don't know about and tweaked his ankle or something, and he may just wake up with a little bleed in his ankle, you know what I mean? Like, I mean, you can't be watching every second of the day, you know?
We've got this,
Yeah.
we can watch it
Yeah.
every second of the day.
Yeah, so, you know, you can't blame yourself for something that, I mean, you're not gonna, what we don't want is for him to be in a bubble. Okay, we want him to have as normal of a life as possible, and that's the way that it used to be with patients with hemophilia. The parents didn't let him play outside. They couldn't ride a bike. They never ran. I mean, I have women that have bleeding disorders that they're in their 60s now, and they go, I never got to run when I was a kid. I never rode a bike. I never played outside because they didn't want him to get
baseball.
They didn't want him to get hurt. They didn't want him to get hurt, you know. And then they didn't have medication, right? So they didn't have treatment for them, or they didn't have insurance, or they had already capped out. You know, they're tapped it out. They reached their cap, and there was no more medication for them. So, you know, you just think about that. You're like, oh my gosh, like you never rode a bike, you never ran, you were never able to play outside with your siblings and stuff. So literally, that's what we call like the kid in the bubble. You know how they had that movie on that one time, or kids when they were in when they had chemotherapy, they were in a bubble. So we don't want that for him. You know, he can be active and he can play sports. It just depends on what sport, you know what I mean, and how much contact, and he can be protected. We have patients that mountain bike, that they go rock climbing, they swim, they golf, they
Just about being aware.
they play softball, they play soccer.
Yeah,
You know
so
what I
they
mean?
have the right amount.
Yeah.
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 You just know when something doesn't look right or feel right.
Football, definitely not, you know, but that's okay.
I don't know the way football is now. They got pads and helmets and everything else.
Yeah, helmets look like his on top there.
Yeah, and they also put you back in after you have a concussion too.
Yeah.
That's all.
Well, and just so you know, patients with hemophilia do not sprain their ankles, they have a bleed. So like when they come into clinic and they go, okay, so what's happened since your last visit? Oh, I sprained my ankle, you know, it was swollen. You didn't sprain your ankle, you had a bleed, okay? And this is more the mild patients. It's very hard to educate the mild patients, and we find that our mild patients have more joint disease than the severe, and that's because in their mind, they're either in denial or they just like,
Kind of push.
I never have trouble with that, I don't have that, you know what I mean, or they just kind of put it back here, and so when they hurt their ankle and they think they had a sprain, they actually had a bleed, but it didn't get treated. So then what happened? They get joint damage, right? And so, and it keeps bleeding, and it keeps bleeding. Well, they end up having worse joints sometimes than our severe patients, because our severe patients are on prophylaxis. So it's really hard to get that fine line of, I mean, we can educate over and over again and tell them things different ways and just try to say it at every visit and every conference or every whatever we go to, you know. But if they're not open to it, it's not gonna happen, you know. Just like they have patients that won't wear a med alert. We had a patient, I told you the story. It was a female. She had von Willebrand. She has a bleeding disorder, and it's severe. She had the severity of severe, you know. She was in a car accident on a Saturday going to work. She had her med alert on. It was a really, really bad accident. I mean, she had internal and external injuries, like everywhere. I was on call that weekend, of course, and I get the call from the emergency room. So I knew that it was like really, really bad. So what I did was I called our hematologist and just had her speak directly to the ED doctor, so there wouldn't be any like back and forth, you know. And so that he could explain to her what all the injuries were, and she could tell him what he needed to do. And he told us, he said, this saved her life. Because had they not known that, she would have died. I mean, she had internal injuries and she would have died. You know, unfortunately for her, she was never right again. Like she has deficiencies now, you know, but she's still alive, you know, and her kids still have their mom, you know, and she's getting better over time. You know, it's a really long road, but she would have died that day. I know she would have. And so I tell that story to people that go, no, I'm going to wear that, you know, and it's like, I don't like it, I don't want everybody to see it. Well, you have the option of wearing chains, the dog tags. Obviously, he can't wear that because he's a baby, right? No. So that we're like, oh, I want to go swimming and you can see it. Well, just take it off while you're swimming then. But we have patients that start now and they never take it off. It's just part of their body. They take a bath with it, they swim, they play, they do everything with it. It's just part of their body. It never comes off unless they grow out of it and then they need a new one, or if it breaks, then we get them a new one. So we highly recommend those metal alerts. Because if he's in an accident and mom can't speak for him or dad and they're unconscious, then who's going to speak for him?
Yeah.
You know, it's not going to be a card in the glove compartment or a card in mom's purse or dad's wallet. You know, it's going to be
All their person.
yep. Does that make sense?
Can't go back, buddy, can't go back.
He tried.
He's looking. He's like, what am I gonna do?
Okay, so some of the other areas that if he receives an injury to, that could be a major bleed, would be his eyes, okay? His abdominal area, his chest and his back. We have all our organs here, right? The kidneys here, if he falls and it hits his back, or if he's, some kid at school kicks him and you know that they, you know, kicked him in his back. That could cause damage to his kidneys or cause a bleed. In his head, we went over the head already, his neck and throat. Why would that be severe if he got hit or injured in the neck and the throat? Choking, drowning,
Carotid artery.
your airway. Okay. Yeah. You could have swelling that it cuts off his airway. All right. We talked about the groin and the hip. So if he starts urinating blood, okay, then yeah, I mean that could be. But when we have some patients that call and they say, oh, I started urinating blood, so then we ask them specific questions, which I'm not going to say the questions right now. That's one area.
It's okay to say that stuff in front of her. She's
Okay.
Yeah.
So like we'll say, you know, say to an adult male, we'll be like, are you sure it's okay for me to say that? But you know what I was going to say because I said it at the daycare center. Okay. Like, have you had rough sex?
Yeah.
Okay, because that could cause blood in the urine.
Yeah.
Have you been masturbating? You know, because that could do that. Okay. No, or yeah, you know, okay. Well, we tell them not to treat because what does a factor do? It forms a clot, right? Mm-hmm. So if they're urinating blood, what we tell them to do is strict bed rest. The only time you get up is to go to the bathroom. Strict bed rest. Push the fluids, water, cranberry juice. No, I'm gonna go to the grocery store, I'm just gonna go here, I'm gonna do this, I'm gonna, you know. The only time you walk is from your bed to the bathroom and back to the bed, and then push fluids, water, cranberry juice. You need to flush the kidneys because we don't wanna form a clot, right? Because then we're gonna block his urine, the ability to be able to be expelled or, you know, for him to urinate, okay? So that's one instance that we don't tell them to treat, okay? But in the eye, I mean abdominal area, you don't know what's going on here, you know, with all his organs. So if he receives a blow or you think he did to his chest or any area like that, then you need to take immediate action, okay? So like right now, this is what we use, like for what preparation is needed. This is what we're using for Jordan, you know, really good hand washing. The nurses wash their hands real well before starting to get all his stuff together. They wear gloves while they're accessing his vein. We use a tourniquet. We have a sharps container. We use alcohol wipes. We have the little gauze to use after we take the needle out. We have a tourniquet. So we can have that vein pop up as much as we can. Sometimes the nurse Nicole is his primary nurse. She's a pediatric primary nurse. And sometimes she can't see it, but she can feel it. Like the other day, she told the other nurse, "Oh, Lisa, can you feel this? Or can you see it?" And she couldn't see it. I don't know if she could feel it, but Nicole's like, "No, I can feel it," you know? And then the slightest movement, just say it was this vein here or something. If they're holding it like this and the nurse isn't holding it the correct position, or if he moves or something, you know, we're not holding him tight enough, just the difference between this and that is gonna make a big difference for the nurse that has the needle in her hand when she is in control because she's the one with the needle, right?
Yeah.
Then she'll be like, "No, you gotta hold it like this," and then she'll hold him and she'll go in and she'll get it, you know? So what do? We get the blood flashback. And you said she usually waits for the blood to come all the way back. You can do it two separate ways. You can have the factor all mixed up in the syringe, primed in the tubing already for the butterfly, prime meaning there's no air, and then you see a little flashback, and then you take the tourniquet off, and then you push the factor in. Or what she does, everybody does it differently, is she puts the needle in, no syringe connected, she lets the blood come all the way back to the end of the tubing, and then she kinks it off, holds it, puts the syringe on it, and then she'll push the factor in. So, if you have 5 nurses do it, 5 nurses are gonna do it 5 different ways. As long as he gets his medicine and we're doing it with an aseptic technique, it's all good.
My issue is when it's gonna be hectic and he's flailing or whatever and we can't get his vein. Cause
Okay,
like, in the event of an emergency, he's not gonna just be sitting there with us holding his.
Well, but then if he has a port,
Yeah.
okay, if he has his port, then if you've already given him his medicine, or you can take your stuff with you to the hospital, like you can have like an emergency little pack of everything
Ready
that
to
you
go.
need for his access, okay? And you grab that bag and you grab the bag of his medicine and you go. And then ask them to let you, or we can say, please let the mom access him. She's proficient, she's been trained, she knows how to do it. Because every different person that accesses his port that hasn't been trained by us, we don't know how they're gonna do it, and we don't know how of
They
a
may not know how to.
sterile technique,
Yeah.
you know, it might be not so great. So we want to try to limit the chances of him getting an infection in that port, because that port is like directly into his bloodstream. And that can be very, very dangerous for him if he gets an infection.
I become a phlebotomist. My sister-in-law became a phlebotomist after her son
Oh, really?
got diagnosed with hemophilia A.
And that's what she worked on?
No, she's a phlebotomist, yeah. So she can do all those stuff without
Yeah.
worrying about it.
Usually we don't put a Band-Aid on the area, we usually put a little gauze, we hold pressure on it right away when we take the needle out. So at that point, we'll be like, okay, usually mom's holding it, cause she's like holding him right after the treatment. And then, we'll put Coban, okay, on it. And the stretchy, you know, it's kind of elastic, yes. And then we'll say just keep holding pressure on it for at least like 5 minutes or so, even though the Coban is on there. And then I don't know, usually leave it on till you get home. Or,
Alexis, we've also had to request like multiple nurses, and then both of us have to go back there because she used to not cooperate. So it was like, yeah, Dad would hold her, I would hold the arm, the nurse would do the thing. Like it's just
Yeah.
you
We
figure
had
it
to
out.
do that when we had to draw the blood for the first time.
Yeah.
So Chris and I had to hold him
Yeah.
down and then they had to do it.
Like Michael used to have to like,
You
Bear.
still, I mean,
like
yeah.
bear hug.
and I used to have it,
but
yeah.
now she's like, okay, I get ice cream after this.
Yeah, so she's coming after.
Yeah.
Yeah.
No, she gets ice cream.
Oh, she gets ice cream.
Yeah.
Oh, okay, I thought you said she screams after.
No, she doesn't.
Okay.
It's good now.
Yeah. Oh, that's good.
Yeah.
Maybe he's gonna start that
Oh,
too.
we get all the things. We get whatever to make it easy.
But I had a period.
I got the camera.
He doesn't like that party, huh? Yeah. I had parents of children. The mom was so afraid, and she was like, I can't be in here, I can't do this. So she was by herself, and Dad went there. Like, would be, it's okay, you know, just go out to the waiting area, we'll come and get you. It's okay. You know, some people can do it, some people can't, you know, or they don't want to, or it was just too hard for her to, like, be holding him down knowing that we were gonna be doing something that hurt. she knew it had to be done, she just didn't wanna be a part of it. So we would send her out to the waiting
I would
area.
rather be the one.
Yeah, we would send her out to the waiting area, and then I'd call whoever many nurses we needed, and then we would do it, and then we'd go get mom, and everything was fine. Yeah, and at that point, it was all good. Okay, so what do you do if there's an allergic reaction? So say that there's this much in the syringe, or this much in the syringe, and there's still this much in the syringe, and he starts having an allergic reaction. What is an allergic reaction to medication?
Rejection. Is it because he's had the antibodies now? And
No,
that's
this is
why it's
just
not-
an allergic reaction in general.
What are we looking for?
What?
Are you asking what the signs are?
Yeah.
Like a
Rash.
rash
Red eyes.
Yeah.
rash
Yeah.
Short of.
He wasn't coughing, and all of a sudden, he's like clearing his throat, or he starts coughing. Well, that's not normal, right? So we stop the infusion right away. Yes, this is liquid gold. Yes, it's very expensive. Yes, he needs this medicine. But if he's having an allergic reaction, we're gonna stop immediately. It doesn't matter how much is left in the syringe. You're gonna take the needle out. You're gonna, put a pressure bandage on it, and you're gonna give him some Benadryl, or, so you always wanna have that on hand. Okay, so whoever's taking care of him, if he has an allergic reaction, you should have that on hand anyway with kids, right? But, and then like you wanna call the center and say, hey, this is like, we gave him some Benadryl just now, but he's still like coughing, or he's wheezing, right? Wheezing, like when the air trying to go through, but it doesn't have, the airway isn't fully open, and he's struggling. You need to get him to the emergency room right away. So do you put him in the car and take him to the emergency room? What do you do?
You call ahead before you go
You
there?
call 911. Yeah, yeah. You don't put him in the car, okay? I don't care if the hospital's 5 minutes away, you call EMS, because they're gonna be here and they're gonna treat him immediately, and he will be monitored. If dad's at home and mom's in the car and he's in the car seat and she's freaking out and he's screaming and crying, he's having trouble breathing, mom should be driving, right?
No.
Yeah, I don't care if it's 5 minutes away, because they could have an accident right around the corner. She could get stuck in traffic, and then she's not gonna make it to the emergency room, and then he's gonna be in trouble. Okay? So you call 911.
Is it possible to develop an allergy to it?
Yeah, and that's like what we talked about with the inhibitor. It's more likely for him to develop one with the first 50 infusions. And it also depends on your ethnicity as well. Blacks and Hispanics tend to, for some reason, I don't know what it is, but are more prone to developing an inhibitor than like Caucasian. Okay? But yes, to your answer, he could be on it 3 years and then he's gonna get an inhibitor. Okay? Oh, and there you go, what's an inhibitor? Okay, so we already talked about the med alert. As far as where it says points to remember on page 20, points to remember, like for the kids at school and all, I was telling Alexis and the ladies at the daycare, as he gets older, it's up to him what he wants. Like, obviously the parents are gonna share with the school, right? They have to know that he has a sleeping disorder. We can come, like I do school visits and daycare visits and correctional center visits and all kinds of visits. We can come to his new school and talk to the nurses and the teachers and the playground people and the principals, so they're aware of what it is. They usually feel a lot better, like the ladies did at the daycare. They said, I feel more at ease because I know now more about it, and I know what to look for, and I know what to watch, what to watch for, okay? So knowledge is power, all right? So if you ever come across anybody like that is taking care of your child, like at school or something, just let us know. I mean, we're more than happy. As they grow and they change schools, we usually go to the new school until they're there. And if they've had a change, like one school I had to go 3 times in 3 years because the nurse kept changing, the personnel kept changing. So we had to keep going, but we don't mind. We'd rather them be educated about it and have some knowledge, or at least know who the contact people are and what to look for and when to call, than not to know anything at all. Okay. I have to go over all this stuff in school because we kind of already talked about that, but So, I don't know, I used to do the role like, Nicole and Lisa and Demetra with the nurse specialist, but I'm the outreach nurse now, so I have a different role, but I still do that role too, because since I know that job, I'm always like filling in and stuff. But in clinic, I know that I started with the kids early on. You know, they should be talking to him, and as he gets older and he can start answering questions, you know, like ask him, what, do you have factor VIII or factor IX? You know, like what's your diagnosis, or, you know, just something to get him to start learning about this early on. Because one day mom and dad aren't gonna be there, right? Or one day he's not gonna be here, he's gonna be at college or move away, or he's gonna get married, right? He's gonna have kids. So he's not gonna be living here with mom and dad anymore.
Yeah, right.
I don't know, they always come back and so, but you know, you want him to be
That might be nuts.
able to speak about his diagnosis, be knowledgeable about it. You want him to be able to go to an emergency room and say, I have factor VIII deficiency, that's hemophilia A, this is my medication. This is what my dose is. What is your severity? I'm severe, you know, I don't have any, less than 1%. I mean, he has to know at least those basics to be able to take care of himself as an adult, you know? Because I can tell you right now, we have patients that are in their 40s and 50s that they still come to the clinic with their mother. Okay? Or we still have their moms that call the office and they're 40 years old. So, no, I'm serious.
No, I'm serious too.
Yeah. And you're like,
He's gonna know his
And you know,
diagnosis when he knows his address and phone.
No, he will know it.
and you're like, okay,
But you're still gonna call.
so let me give them this. Okay, so some of them are older patients, and like I said before, remember they were kept in that bubble. Mom did everything for them. Mom protected them. Mom and dad, you know. So that they kind of grew up that way with the constant hand holding and all, but it doesn't need to be that way anymore, you know. We try to make them as responsible as possible for their diagnosis. Okay, so Alexis and Chris, they have our contact information. Our number is 504-988-5433, which is LIFE. The last 4 numbers is LIFE. Okay, and like I said, we're there 24/7, 365 days a year. And they know, huh? The very last page, right here.
On the last page.
And it's in the sheet that I sent y'all to.
Okay. So if you're gonna know a number, or if you wanna put a number in your phone, like if you take care of him and say they went to a concert and they didn't hear the phone or something, but you know you need to talk to somebody.
Yeah.
Don't ever hesitate to call this number, because you will get a person, and it's gonna be the doctor's exchange. Tell them name, date of birth, what his diagnosis is, who you are. It's an emergency, I need a nurse, and they'll get us right away. Okay, and if the nurse that's on call for some reason didn't hear the call or didn't answer right away, then what they usually do is they'll try like a different nurse, okay? And I don't think they're gonna get upset because he calls somebody else, you know?
No. I told her, if I didn't answer the first time, then she knows, call straight to it.
I like, does his little bracelet have a
Yes,
certain thing on it saying this is,
it says hemophilia B factor IX. Deficient.
Okay, so,
I think on the other side it has Nicole's phone number, it doesn't have.
oh, okay. And just so you know, his allergies, he doesn't have any medicine allergies, but he does, because what we do is we tell our patients to say you're allergic to aspirin and NSAIDs like ibuprofen, because you don't want him to have that. So a lot of our patients just say, I'm allergic to it, instead of saying I have a contraindication to it. I can't have it because I have a bleeding disorder. So the way they remembered was, I have an allergy, and that's fine. If that's how they have to remember it, that's what it is.
Yeah.
Okay, so no question.
Yeah, it's like I had severe nosebleeds all my life, and doctors like, don't take aspirin. So it's an allergy in my chart, but if I'm having an MI, I'm going to take aspirin because I'm not going to.
Yeah, yeah.
And if you have a fever that I have to, that's different, but
Yeah.
you not anyway.
Yeah.
Yeah, like we may say, go ahead and alternate the Tylenol with the ibuprofen. Give the Tylenol every 6 hours, give the ibuprofen every 6 hours, but intermediate, like that. But it may only be for like a day or two, not like give him ibuprofen for,
Yeah, like a regular child would get.
yeah. So does anybody have any questions?
Now, I know I won't be able to still working by the time he's 18. But anyways, if I would ever have another patient that has either factor TXA, is that good? Is that good for them?
Yes. So you have some now? You have some Mamacard?
Yes.
Oh, you have TXA?
Yeah.
Okay, I didn't know.
So what he's talking about
So-
is it's TXA means
Like for when he bit his tongue to give it to us.
yeah, it's tranexamic acid. Okay, it's an anti-fibrinolytic. Okay, so what does anti-fibrinolytic mean? Anti means against, fibrin meaning clot, lytic meaning breakdown. So it prevents clot from breaking down. So it's a medicine that Alexis has now, and Chris, for if he has, it's good for mucosal bleeds, okay? So it's good for nosebleeds, it's good for mouth bleeds. So when he bit his little tongue and he kept oozing and oozing, she didn't have any of that yet. So Nicole prescribed some for it, sent it to the pharmacy, she got it. So he may need to be on it for several days because what it is that when that clot forms, he's gonna be more susceptible to bleeding when that clot comes off, right? So, because he doesn't have that protection anymore. So it's not usually a one-time, just give him a dose. It's usually 3 times a day while he's awake. And it's usually for at least 5 days, 7 days, 10 days, just depending upon how bad the bleed is.
Okay,
And
so
where it
good
is.
diet.
But you see, she said he kept like because it's on his tongue.
It was a
So like he's
breakthrough.
probably putting
Yeah.
things in his mouth and he's probably putting his fingers and he's probably just moving his tongue around in his mouth, so it's gonna be
So
more
that's in a
susceptible.
pill form that she has?
No,
or
it's a liquid, it's a liquid
form?
form. But we have it in the pill form, which is the 650 milligrams, right? The tablets, but you take 2 tablets, 1,300, 3 times a day, for however many days we tell you. And some of our women take it for their cycle.
It's like we use that, we carry that for severe shock bleeding, and we do
Yeah.
2 grams.
Yeah.
So, actually I used it last week on
So
her
you did.
so.
That'd be really something good for them, I mean, not just.
Well,
Awesome.
no, when something like that, you call an ambulance and tell them that this is what they have, they know, basically.
Yeah.
And we put it in a chart already for us, so when I call, it should pop up for our address.
And hopefully, and of course, it all depends on where you're at. You tell the ambulance, I need to go to Children's Hospital in New Orleans. If they say no, that's too far, tell them no, I need to go there.
No, they
Whether
told
you
us
like
to
it or
do
not.
that, yeah.
Yeah, so.
And they know when you need to be seen, like right this
Yeah.
minute. You know what I mean?
They said it
Yeah,
used to
if
be-
I was in this area and I'm not just picking up Jordan, it's just anybody, and I felt, well, no, I think you need to go to the Lake Children's because it's closer and
Yeah.
it's more
Like
severe.
they need to be
Yeah,
stabilized.
stabilized, and then we can take care of it from there.
So. Okay, anybody else? Anything in particular, like anybody?
Do anybody have any other questions? Concerns?
You've been doing a lot of work? Reading. Oh.
I work at the suppliers. Daily.